until recently, when we would do our annual trips to Guatemala, inevitably when we'd be out visiting families, there would be so many questions people have about lots of different issues. And eventually I was like, I know some other wonderful people who are actually the experts in these areas of health related issues or issues specific to women and their rights and all of those different things. So I started doing these very fun dinner get together where the team could ask them all the questions that I don't necessarily know the answer to. And it's also exciting because it's, we all get to do what we're good at this way. And I think we make a even bigger impact. So that's part of why I'm so excited to do this tonight. So yeah, so we're planning on having this be more conversational. There won't be any PowerPoints. So definitely, if you guys, as people are sharing and talking, go ahead and put your questions up in the chat. And so tonight, on our panel will be, oh, hi, Rebecca Kwiatkowski, you're up late. I'm glad you're here. It's my sister. She's in Virginia. I love all the support. So we have Kate Flatley from Women's Justice Initiative, and then Kraemer Diaz, who's with Maya Health Alliance, and then Ruth Krishnan, who's one of our awesome Home for Home members who's helped fund quite a few homes already. I think she's well on her way to number 6, I would say. Definitely getting it done. So it's exciting. So we'll be hearing from all them, and I'll let them explain more about what they do. But I just wanted to give a brief update on what's happening with Home for Home. And it's just after last year it's been a wild ride, as we've all had. But the thing that totally blew us out of the water was just what a great year we ended up having in 2020. My goal for the year was to hit the 300th home that we funded, and we blew way past that. So we're at already here in March, we're at 349 homes funded. So it's kind of crazy how far along we are. And just in terms of those 349 homes, I would say of them, probably 340 of them are probably women are the head of those households. And a lot of those are single moms. So this is near and dear to our heart to really look at, like, how does this empower women? How does it help them? And we're also excited to be looking into lots of different just housing solutions, because one size doesn't fit all, and just trying to find ways that different families have different needs. For some, it's like, their house might be pretty good, but what they need is to get rid of that dirt floor, and let's get them a concrete floor in there. And I'll let Anne explain more about the benefits of that and health related. And then we're also just, Ruth can speak to this probably with real estate here. You've just seen prices are going up. And of course, it's the same in Guatemala. Prices are going up. So we're trying to find more and more interesting and just good, solid solutions that are cost effective and that involve the families as much as possible. So we have a really neat project we're doing with Habitat for Humanity right now, where we're really trying some of these different solutions out that are new to Habitat. And so we're excited to be kind of on the front end of that with them. And 12 of the homes we're doing with them are in partnership also with an organization called Project Concern International that does a lot of focus with nutrition, which is just, if anybody's following just what's happening internationally, and nutrition is just brutal right now. Like, so many families and especially young children are really being pushed into malnutrition issues. So that's kind of the big picture thing with what's going on with Home for Home. And I just want to say thank you all for being here tonight and giving us your time and everything. So Kate, Kate was already on one panel today. So I'm gonna let you kind of get it out of the way. So if you wouldn't mind just telling us a little bit about what Women's Justice Initiative is, and yeah, that'd be
Sure.
great.
Absolutely. First, Chris, thank you for this opportunity. It's wonderful to be here with all of you and, to have a chance to share our work and also sort of talk about kind of the intersection between the work that we do around preventing violence against women and girls and providing safe homes. So it's sort of a different way for us to look at our work, but, over and over again with the cases that we see, we just see this constant important link between access to property, access to land ownership, and a safe home as kind of a really critical component for survivors of violence in terms of creating a safe environment for them and their families. So I thought I'd just start by providing a quick overview of the organization I work for, the Women's Justice Initiative, or WJI. And then I'll talk in a little bit more detail about kind of this connection between the work that we do and the work that Home for a Home does. So the Women's Justice Initiative works to improve the lives of Indigenous women and girls in rural Guatemala through rights education, access to legal services, and gender-based violence prevention. For those of you who don't know, Guatemala has some of the highest rates of violence against women and girls in the world. And Indigenous women are especially high risk due to financial, geographic, and linguistic barriers that greatly limit their ability to access services. So for the past 10 years, WJI has worked to fill the gaps in rural communities, implementing a rights-based methodology that combines holistic service delivery with rights education and justice system capacity building. We have 4 main program areas that we focus on. Our first is our rights education program. It's a 6-month legal literacy course that provides women not only with knowledge of their rights, but also the skills necessary to exercise those rights. We have an adolescent girls program that focuses on working with girls to help them assert their rights and also delay marriage and achieve their personal goals. We also train what we call community advocates, which are women in the communities where we work who become leaders, rights educators, and mentors to women and girls, and especially to survivors of violence. They serve as resources in the communities and provide support and accompaniment. And finally, we have our legal services program, which provides free legal services to women in need. And we do this by bringing lawyers and paralegals to their communities and providing our services in both the local language, Cachical, and in Spanish, and also by accompanying survivors throughout the legal process. We provide legal services in 2 main areas. One is around violence against women and girls, and the other one is securing economic rights for women. And this includes land titling and registering land for women and their families. And about just over 20% of our legal cases annually are related to property rights and land titling. In addition to these 4 kind of focus program areas, we also partner with traditional community leaders and government institutions and service providers such as judges, police officers, to build their capacity and improve their responses to violence against women and girls. It's interesting because when we start working in a community, we start with our women's rights education program, and that's a 6-month course where we give over 20 workshops on different rights and legal protections that exist. And what we see is over and over again, a real uptick in women seeking legal services after they've received the workshops on violence against women and on property rights. And what we see is just property rights are especially interesting topics in the communities where we work, because many of the families we work with don't have legal title to their land, or the land isn't legally registered with the government. Often we find that women are not even aware that they can title property in their name or potentially co-title it with their spouse. And over again, we have cases of women who've received a piece of property from their parents as an inheritance that then they put in the name of their spouse rather than in their own name, whether because they didn't know that they could put it in their own name, or because there's just really deeply held beliefs in the communities where we work that men should administer and kind of oversee land and property within the family. In fact, it's estimated at the national level that only 7% of landowners are women. So it's such a small percentage. And what you see, as you can imagine, is that lack of access to land and property significantly increases gender inequality in rural Guatemala. So it limits access to resources, access to credit, increases women's economic insecurity, and also undermines women's decision-making power, not only in the home, but in their communities. And I think, what we've seen over time, and this isn't something that I necessarily recognized at the beginning of our work with WJI 10 years ago, but one of the greatest barriers we see with survivors of violence that we work with is that, they're really often not able to leave an abusive relationship and really find a safe environment for themselves and their families because of the lack of access to property or a home that's their own. So, that economic limitation really means that women are stuck living in abusive relationships and really don't have a safe home where they, feel that they can live with their children. So, those are some of the things we see, and there's a real intersection there, obviously, between the work that we do and what Home for a Home's doing. And, when Chris mentioned in the beginning that many of the women that they work with are single moms, I would, wouldn't be surprised if many of them are also survivors of violence. And, that this is an opportunity for them for the first time in their lives to really have a safe home and provide a safe environment for their families.
Absolutely. And I've seen that. I mean, I know Nick might remember visiting there's one woman in particular that comes to mind that, like, you could see in her body the damage that had been done over time of an abusive relationship, and just how meaningful it was to have a solid house with a door that locked that her ex-husband did not have the key to. It was huge, very huge and life-changing. And definitely the horror stories I've heard of women whose, the family members, passed on the land, they got a house built, and then whoever in the family actually had the real title to the land sells it out from under them because their name is not on the title. So that's something we take very seriously with the partners we work with, ensuring that those families have definitely got the land rights for the house that we're working on building with them. So those are huge things, and it's really important work you're doing, Kate. Thank you so much.
Thanks. I just saw a question in the chat, I think, to me about the communities that we work in. And I can quickly just say, we work in the Cachical region of Guatemala in about 60 communities and 3 municipalities, in Tecpan, in Comalapa, and in Patsun.
On that, Anne, do you want to explain what you guys do?
Yes, that sounds great. Thank you so much, Chris and Home for Home, for having me tonight. I'm Anne Kraemer Diaz, and I'm a medical anthropologist, and I'm the director of Wuqu Kawoq, or My Health Alliance. And we've been working in Guatemala for over 15 years, really trying to find the best ways to provide healthcare to rural communities. And I think, the work that Home for Home is doing, the work that WJI is doing, all of this is so key. And I don't want to follow Kate's talk with a lot of more sad details, but unfortunately, I do have to bring a lot of those up because that's the current situation in Guatemala. It is really difficult, and it really also demonstrates why we need to partner with so many of you. We need your help. There's a lot of work to be done due to the setup of the country, the corruption in the government. We have a lot of work to do. I want to start off a little bit more about My Health Alliance, and then I'll jump into how our work ties into Home for Home and a little bit about the COVID situation going on here. My Health Alliance transforms the health of communities in Guatemala by creating high-quality healthcare solutions to close critical gaps in care. Our team is led by Indigenous women. We work hard to overcome barriers to health by uniting medicine, culture, and language. We're a global leader in research and treatment models for chronic disease, including malnutrition, diabetes, heart disease, and cancer. We usually perform several studies a year based in implementation science. We measure everything. Our goal is to really understand that the work we're doing is the best work for the communities here in Guatemala. We believe that everyone, no matter where they are born or what language they speak, should have the highest quality healthcare. We serve about 20,000 patients a year. We focus heavily on working in the indigenous languages. We currently work in 6 languages. We really do what's kind of one-on-one care. We go to the homes. So in our nutrition program, we're visiting with moms in their home. We do pap smears at home. We do family planning at home. We do a little bit of everything we can at home. We do have clinical services where patients do come to us as well. We focus on really looking at frontline care and doing last mile health. Oftentimes our patients can't get to health centers, or they're turned away from health centers, especially during these times of COVID when the health service was really trying to adjust and a lot of health centers were closed or doctors didn't have PPE and had vacated their stations. We go kind of where no one else is. We've really focused on creating solutions that work in Guatemala. So one great example is with our work with midwives. They're traditional indigenous midwives. Many of them don't speak Spanish. We work currently with many midwives in Cachiquel who speak Cachiquel Maya. And we've created a cell phone app where they basically run through a checklist looking for high-risk pregnancy concerns. And if they find a high-risk pregnancy, they immediately are turned to our 24-hour call nurse, and she is able to set up a visit to the hospital. We're able to get women who sometimes are 3-4 hours into the countryside to the hospital. But then as Kate talked about, there's a lot of issues around language, around women having rights, and that happens in the hospital too. Unfortunately, women will go to the hospital and they could be turned away. They could, be made fun of. They're not spoken to in their language. And so we have an advocator who is there with the woman at the entire time. She speaks Spanish and Cachiquel. She's there to, provide all the translation needs as possible. She's there to advocate for that woman so that she can have the best birth experience possible. And we're very happy to report that over the last several years, originally when we started this program in 2016, there was 8 maternal deaths in the region we're working in. And over the last 3 years, we've had 0 maternal deaths in that region. And we're very, very excited about those results. And it's really great to see how we're linking together the public healthcare system and the rural indigenous culture and really seeing that all work together. And we're really just playing on the sidelines, being able to make things work. Looking at the big picture of homes and why are homes important? I think a key piece to that is mental health. And I think all of us can think of our home as a safe place. Home is just more than 4 walls, right? It's where you go, it's where you feel safe and secure, and it can make you feel connected to your family, to your community. When you think of where we spent a lot of our time this past year is our home. And we are all very familiar with that place. Well, what if you don't have a great home? What if you have a dirt floor? What if you don't even have a great stove, if your stove is just an open fire pit? What are all those concerns for your family members, for your children? What does that mean for you? Well, looking at the healthcare side of things, looking at mental health, if your home is falling apart or you don't have a home that you can put together, as a mother, you feel unsafe, you feel insecure, you're anxious, you could be depressed. All of your relationships could be under strain. How are you able to take care of your children if your house is falling apart, if you can't keep, the floor dry? Relationships can break down, loneliness, money problems. The list can go on and on. And when you can have a home where you can be safe and when you can have your children there, when you can provide something for them, it really makes a major difference. And what we've seen with a lot of our mothers, unfortunately, when we do a lot of work with prenatal mothers, we see a high amount of depression. In fact, many of the women are depressed. And unfortunately, mental health care here in Guatemala is sort of a black hole. We're attacking it to the best we can, but there's not enough resources. There's not enough places to send people. We're doing what we can. We're training our staff. We're working with psychologists, but there's really a large hole there. And I think, what WJI does is really, really key in being able to provide a lot of empowerment for women, giving them land titles, giving them to understand their rights. And then what Home for Home, giving someone a home is so key. And then looking at the healthcare piece, if a woman has a home, what does that do for her child? Well, if you look at a dirt floor versus concrete floor, that can really, transform the outcomes for a child, because that child is not picking up a lot of germs. The concrete floor, you can actually clean it, whereas a dirt floor, you're just kind of sweeping things away. You're not ever really, cleaning the floor. And we can really see that for children who suffer from malnutrition, when they have a concrete floor, that really leads to better health outcomes, because they're not so sick all the time. They don't have stomach problems and diarrhea, and the food that they're able to take in, they actually get the vitamins. So that's so key when looking for a family to have a home. In talking about children and mothers, one of the key problems in Guatemala is malnutrition. Chris touched on this earlier, but unfortunately in Guatemala, the national rate of malnutrition is just around 46%. However, when you go into the rural indigenous communities, it's 80 to 90% of children are malnourished. And often the malnourishment that we're looking at is called stunting. You might think, what is stunting? Stunting means a child is short for their age. So that means they're missing several inches. We might think, oh, well, they're just not as tall. But what that actually translates into is their brain size. And that is what we're really worried about. Because when you're 0 to 2, and those 2 years of life is when your brain grows the most in your entire life. And that is when we have to be feeding our lovely children as best as we can, all the nutrients, all the protein they need, so their brain can grow to the best capacity. Because if we're not providing children with the right nutrients at that age, we're setting them up kind of for a different lifespan their entire life. And so when we look at children who suffer from malnutrition, we're looking at children who have diminished success in school and work. They have higher risks for respiratory, digestive, and chronic diseases in adulthood. Indigenous children in rural Guatemala are really heavily affected by chronic malnutrition and these lifelong effects. But if we're able to really focus on that first 1,000 days of life during pregnancy, and then in the first 2 years, we can really set up a child for a much better future. And when we're looking at the effects of COVID, unfortunately, COVID has really spiked the problems for food insecurity. In fact, by early June 2020, we were seeing reports of children experiencing acute malnutrition, where literally they don't have enough calories, spiking to one child every 30 minutes. I mean, it was an extreme spike that we're still dealing with here in Guatemala with extreme food insecurity. Also, due to COVID, there's lack of family planning. Women didn't have resources. Many of the health centers were really focusing on COVID, but basically they didn't have all the services available to them. And the lack of having a safe place, of having a home, having a place to go, was really difficult during COVID. You might think, well, maybe they even had a home, but some women were forced to be trapped at home, maybe with an abuser, some children as well. So, homes can be also difficult places, but that's what really WGI is really working on, is to provide that safe outcome. So that's some of the work that we're doing here in Guatemala, is really focusing on healthcare, working in rural communities. We work in 8 departments across the Highlands, and it's really great to be here tonight. So thank you.
Oh, that's amazing. Thank you, Anne. Hey, there's actually a question that Leslie had. Are the mothers provided with micronutrients in pre-conception periods?
So in some areas, we do, the women that we can work with, if we can get them during their prenatal stage, we do provide prenatal vitamins. And we provide all of our children with micronutrients from 0 to 5, really focusing on the 0 to 2 age. Unfortunately, due to the way the Guatemalan government works, the health centers don't always have all the resources to provide prenatal vitamins for all women. If they're in our network, yes, we're giving them.
That's amazing. Yeah, and I would say the other issues too, like, Anne mentioned, like cooking over an open flame. And I cannot tell you how many houses I've gone in where there's a mom cooking and her small children are in there breathing all the smoke. And so like the respiratory illnesses that are involved there. And then, and just, little kids in open flames, hello, like how many kids end up getting burned, so stuff like that. There's a lot of those issues, just like the smallest things that can make such a huge difference in their lives. Yeah, so you guys, I love the questions. Keep them coming. As someone, as we're talking all about home, I think Ruth must have housed, I don't know how many, rehomed many San Franciscans last year. So yeah, Ruth, we'd love to hear from you and just your perspective from this side of things, and just even your experience just giving back and your thoughts on that. I know you have some great things to say, so I'll let you take it from here.
Well, I feel like I don't have anything great to say following up from, Kate and Anne, because helping people buy a home, I don't think is nearly as significant as the work that you guys are doing. So thank you all for all your hard work. I got involved with Home for a Home a couple of years ago. Nick and Sarah and Tracy and, a lot of, the great colleagues that I have around San Francisco, I saw what they were doing and I was like, wow, that's really amazing and impressive that, such a big impact can be made with, relatively a small amount of money. I mean, compared to what it would take to build someone a home in San Francisco, for example. So I'm a really big believer in giving back, and, am committed to giving back 5% of my income every year. Home for a Home has been something that has been getting part of that. And it's really just been absolutely amazing to watch all the hard work that you guys are doing every day. And I can't take credit for doing anything amazing aside from writing some checks here and there, but it's really gratifying to know that, we're able to house people and change their lives and make such a big difference in their basic needs. And so I'm really proud to be part of this group and, just happy to help you guys in any way that I can.
And I would say the 3 executive directors on this call right now would say that check writing we couldn't do it without it. Either of you want to say anything about that, feel free. Yeah, no, it is truly huge. And I love your commitment and like really using what you're doing to do good in the world, Ruth. Like truly, I think it's an important piece. Like it all has to work together.
It does. I was just going to comment. Yeah, we can't do this great work without funds. Obviously, that's so needed. But I think it's really exciting to see Chris, talking with Ruth, to really partner with donors when you can really have these great open conversations and do work together. I think sometimes there's quite this weird dynamic between I'm a donor and I'm receiving the funds and should we kind of not talk about things? But I think you can really do so much more when you can talk together and say, hey, where do we want to go? What can we think about? What can we innovate together? Where can this money really do the best? Because sometimes I know Kate and I've had many of these conversations, you get scared to kind of dream and say what's possible. And I think it's really exciting to be able to have those really great conversations with donors.
Absolutely. And I mean, I think it's just, it's wonderful to see kind of that open support and, real relationship and partnership. I talked about this a little bit earlier today. It's one thing to kind of have the donor grantee relationship, but a real partnership. And that's what I've just seen from the times that I've been able to meet with during trips from Home for a Home and kind of meet with those who are coming down to Guatemala. It's just a real partnership and kind of everybody's just so dedicated to the work, which I think is so important because it's very rare to be able to really speak to donors and say, these are our needs and we need you to meet us here. And this is truly what is going to make a difference with the work that we're doing.
Absolutely.
Well, it's so nice to see the full picture of it and everything that you guys are talking about. I think for me, it makes the work more, or the donations more impactful and more meaningful to hear a little bit more about it. So I appreciate you guys inviting me to this call.
Absolutely. Okay, so Leah. Oh, wait, no, Susan. Sorry, I thought that was Leah for a second. So Susan asked, thank you, Susan. Make sure I'm unmuted. Okay, I am. Okay. How does Home for Home connect with actual families in Guatemala who need homes and or improvements to existing homes, such as concrete floor stoves and water filtration systems? And who does the work in Guatemala? So yeah, this is what's been so huge and was you know, Nick, who's on here, who founded Home for Home, like this was very important from the beginning, was that we wanted to work with local partners in Guatemala, and not have to be dependent on Americans flying to Guatemala to build the houses. So that was huge. And so we have 3 different they're actually nonprofit organizations in Guatemala that build the houses. And yeah, so they hire local masons that do the building. They have their teams that do the family selections, and go through the process and ensure that do they meet the criteria, which I would say almost all the families, not 100% of them, but close, are definitely at the international poverty line and live on less than $2 a day. So they're in that demographic financially, they have the title to their land, and then they're willing to put some sort of effort into the home themselves. So, and we find that there's definitely more pride in ownership. It's definitely, there's just much more respect that happens when they're involved, or even pay for a tiny, even if it's tiny portion of it, that there's something going into it themselves, which I love that. I just think there's so much more dignity in that. And that's what we do. The really one of the fun things that I'm excited about with this new this pilot we're doing with Habitat for Humanity, and hopefully in June we'll have another one of these with the folks we're working with in that, and you can hear more. But yeah, they're really, the families in the communities where we're building are actually selecting the masons to build the homes, and Habitat's providing the architect and engineer to train those masons how to do this new style of home that they're doing, which is pretty cool. And I love that it's more local and, you know, providing jobs for people locally, which is really important. Yeah, without going into many details, but that's does that answer your question, Susan? Okay, good. Let's see, there's another question. Oh, okay. How is COVID affecting Home for Home ability to build homes right now? And what are your hopes for this year in terms of starting building again and continuing our work? So thankfully right now, we're building as many as 3 houses a week, believe it or not. So that's huge. We're yeah, one of our partners is, they're really simple 1-room homes, but we're knocking those out, and it's amazing. So thankfully right now, but for a long time last year, pretty much not much was happening, which was painful, knowing how just the circumstances people are living in. So thankfully, and then yeah, and then just continuing our work. Like, I think just really looking more and more in our intentionality of like who are we reaching, and you know, like the opportunities to partner with other organizations and helping fund homes for their families. Like that to me is like an ideal situation, because they get so many touch points from different people to help make a bigger impact. Melanie Hobson has a question, Kate, for you. Who does the training of the women about their rights? Do Indigenous women earn money training other Indigenous women?
Yes, sorry, I forgot to mention that. Almost all of our staff are Indigenous women, from our lawyers to our paralegals, psychologists, social workers, and our educators who work in the communities. They are all on staff and paid for their work, absolutely. And I mean, it's a critically important piece of our work, of Wuqu Kawoq, or My Health Alliance's work, that the women who are working in the communities are women from the communities where we work. They're designing our programs, they're implementing our programs, and they truly understand the culture and the needs in the communities where we work. So absolutely. And then in addition to our staff members, we also work with community advocates who are local women from the communities where we work, and they receive a monthly stipend for their time with WJI. So they assist us in implementing and training and educating other women, and we provide them with a monthly stipend to recognize their time.
I love these questions. Yeah, and it's interesting, and this is something I think people always find surprising when I share it, but for a lot of the families, especially in the, as I think Anne referred to it, the highlands of Guatemala, like a lot of people, Spanish isn't their first language. And yeah, you can imagine the issues you run up against when, yeah.
I just want to jump in there. As Chris was just saying, oftentimes Spanish is not their first language, and oftentimes people might appear to speak Spanish because they can do kind of trade Spanish and speak in the market and things like that. But when you're talking about things like healthcare or legal rights, things like that, that gets really complex, and it really does need to be done in their language, the language that their maternal language. And that's a really key piece to the work we're doing. And something I want to share that Kate and I are doing together, along with 2 other nonprofits, is we're investing in leadership training for what we view as some of our top staff. And so we're doing really cutting edge leadership training for Indigenous women to, hopefully they can be in my position shortly, and Kate's position, really sharing a lot of the work that they're doing, having this voice from the community, understanding their communities and being able to share it directly with all of you. And so we're working on a lot of key pieces that, sometimes we don't always talk about, but I think it's really neat to be able to see that type of work taking place too.
And just to jump in and reiterate what both Chris and Anne were saying about language, it's such a critical component. It's about language justice. And when you think about women or individuals who are trying to seek services, trying to seek help, whether it's around health services or legal services or reporting a crime, if you don't speak the language and no one there speaks your language, especially if you think about kind of reporting around domestic violence. For instance, in Cachiquel, there really isn't a word for domestic violence. And so speaking about it is a very different, within the language is very, very different than how you would talk about it in Spanish. And what we hear over and over again from our clients is just kind of, for the first time in my life, I knew I could seek help because I felt comfortable speaking to the lawyer. I felt comfortable speaking to the women at WJI and the staff because they understand me and they speak my language. And then they went with me to report to the police or to seek other services. So, I mean, language is so critical. You all see it in the US, we see it here. It's so important to provide interpretation and bilingual services to those who need it so that they really can express themselves and get the help that they need.
Absolutely. I'm checking chat just to make sure I'm not missing any questions here. So I have a question for everyone here, and hopefully there's enough of you on the screen. We can do a show of hands if you're available. How many of you have ever actually been to Guatemala? Oh, there, Carrie came on so he could raise his hand. Awesome. That's pretty cool. So this is great for everybody else to see who it is. Fantastic. Yeah. Let's see here. Can you please discuss the resistance for support from local community leaders and/or Guatemalan government? Anne or Kate, who wants to take that?
Sure, I'm happy to jump in specifically around the work that we do on improving gender equality and addressing violence against women. We really try to approach this work as kind of meeting communities and speaking to them about positive outcomes that can come about from preventing violence against women, preventing child marriage, and looking at it from that perspective rather than coming in kind of in a combative way, in a way that would put men and community leaders on the defensive. And so we work from the start with community leaders who are almost all male and present our work and kind of get their support for our work. And that visible support can then really help us to gain support from other men in the communities. We also, assist a lot of families by titling land. So I think that really helps us be seen in a positive light in the communities where we are. Many of the families couldn't afford to title or register their land. paying a private lawyer. So that helps us kind of get a foot in the door and then start to talk about these other topics. So I think it's kind of a strategic way of approaching it and kind of doing a little bit of like, small steps to get there and open minds, and then start talking about, what things could look like if there was less violence in your community, and what that would mean for your families, what that would mean for your daughters, and really starting to see those changes. And I think one of the critical pieces is that we have so many examples of staff members, of advocates who have really succeeded and are these shining examples of what these outcomes can look like for families and these communities. So I think that's also a helpful reminder and a way to present our work to them. Government institutions are really challenging at times, and it can really depend on who we're working with. So we have certain judges who are great and who are supportive, and we have others who we really have faced challenges with. The same with the police. And because there's a lot of turnover and movement of police and judges to avoid corruption in regions of Guatemala, it makes it really challenging to build long-term relationships. So it's a constant challenge, and it's something that we work on by doing trainings, by trying to approach it as presenting ourselves as a partner and really working with them to help them with their needs. So when we start working, an example would be when we start working in a new municipality, we meet with service providers and kind of do a needs assessment. What's keeping you from being able to do this work in a way that you feel good about and you feel that you're seeing positive outcomes, and how can we support you in that? So it's really showing that we want to meet them and support them, because we also understand that it's challenging work, and we realize that there's so many barriers that they are frustrated by on a daily basis too. So, those are some of the techniques we use, and of course, it doesn't always work. But, one of the things that we really have as a critical component is that we have to have support of community leaders to be in a community. So if we don't have that support, we won't work in a community. And that's kind of like the first way we determine whether we're going to work in a community. And it really does help us kind of gain more support within the population as a whole.
Yes, I'll follow up a lot of Kate's comments and really look at the health side. A lot of things are very similar. We work very closely with community leaders at all steps, looking at the Ministry of Health from nationwide all the way down to like the local health post, as well as community leaders. It's really necessary to be in touch, to be collaborating with them at all times, and really be talking with them openly. And I want to give you an example to really kind of be able to understand how, especially gender inequality, or oftentimes what we call it in Guatemala, machismo, and really the favoritism of men, can really be demonstrated. And we can really look at that in our maternal health care program. One example is, for example, if we have a woman who is in her home and we do see that she has a high-risk pregnancy, she really should go to the hospital to deliver, because oftentimes you're in a community that's 3-4 hours away, very hard to get to the hospital. Well, the midwife has detected her high-risk pregnancy. She's talked with our nurse hotline, and we've determined that she needs to go to the hospital. Well, the midwife will tell her husband she needs to go to the hospital, and her husband might say, no, she's not going. I don't want her leaving my house. She stays here. She doesn't go. Well, we're looking at really high blood pressure. We're looking at the situation that she's got 2 other children at home, that she needs to go to hospital, that we're looking at preeclampsia, like we need to get her to go to hospital. And we try to say, well, we don't want to leave you without a mother of your other 2 children. We need to do all these things. And sometimes we have our nurse there, we have our care navigators there, we have the midwife. Sometimes we have to get town leaders involved in order to get this woman out of her house, because her husband won't let her leave, because she is seen as property. And Kate, I know, deals with this all the time, but women are often seen as property. And even though it's his wife, he doesn't want to let her leave. So that's step one. Maybe we finally get her out of her house, and we get her either in a truck or in an ambulance, whatever it might be. We get her to the hospital. Well, now she's really dealing with the machismo of the system, right? So that was her husband. Now she's dealing with the system. The system in Guatemala says that she has to go into the hospital and deliver by herself. Her husband, her mom, her midwife, no one can go in with her. She has to go alone, because that's kind of hospital policy. even though there's a law on the books from 2012 called the maternal health care law that basically protects women and says a woman should be able to take someone in with her so she's not alone during childbirth. However, many hospitals don't put that they don't allow that to happen. So we're fighting back and saying, actually, no, she needs someone with her. And that's where our care navigator or our advocate is with her. She speaks Kachikel, she speaks her language, she's with her in delivery at the entire time. But while they're in there, our advocate, who's been trained very well to kind of fight back against the system, might be dealing with a machismo or male doctor who is very demeaning, will speak or scream at the patient because the patient doesn't speak Spanish, will really scream at the patient, say bad words, say bad names. And we're really, bookmarking many cases of maternal abuse, things you might not think that are still happening today. Unfortunately, we just recently had to book a doctor for wanting to force a woman to be sterilized. She did not want to have her a tubal ligation, and the doctor wanted to force her to do that. And because she had the advocate there, we were able to stop that situation. But you're looking at a system where this woman is faced from being in her home through the entire system, really having to deal with this really difficult system of machismo, whether it's in her house, whether it's in the system. And that's really what Kate's working against. That's what we're working against. And we're able to overcome it. We also have fantastic allies in the hospital. I'll say the hospital, the leadership for labor and delivery, she's fantastic. And we wouldn't be able to do our work without her. And we can safely go to her and report the maternal abuse cases. Some of the doctors have been, basically taken to task. Some of them have been moved to other hospitals. But yeah, it's a real problem. And it's something that we're fighting day to day.
Absolutely. Oh yeah. I have not had these kind of experiences, but my husband, who's on here somewhere, there's been more than once I've left him in the hotel room and told him, no, you can't come with me to this meeting because they're going to assume you're the boss and not me. So it's like, that's been my very overly simplified experience of it, that it is very much real.
It is. I see two questions. One, I'll jump in, and then maybe Kate, you can get that second one. Are the costs of hospital care covered by the patient or someone else? So in Guatemala, technically, all public healthcare costs are free, meaning depending on what the budget is at the time, depending on how much is getting to each hospital or healthcare center, there are services provided. When you go to the hospital currently, where we are having a lot of our women give birth, you're not paying for the actual doctor's time. That is paid for. But you may have to, depending on the budget at the time, have to pay for labs or exams, down to, things like diapers or syringes, or, it really depends on what's happening at the time. We step up and we cover those costs for our patients, but it really depends. Sometimes we don't have to cover anything. And sometimes, depending on the budget, there's not really much available at the hospital. And so we have to buy a lot, but the doctor's time is paid for, always.
Yeah, and Kate, did you see this question from Allison?
Sure. And I did want to jump in with a kind of a more positive story, because I know sometimes it can feel just depressing what we're talking about, and kind of how do we continue our work. So yeah, we have so many success stories of survivors of violence, of women who've come through our programs, of leadership development. I mean, it's hard to choose one, but I'll just talk about one, because this is one of my favorites, because it really weaves kind of the story of our programming and how it all works together. There was a woman in one of the communities where we work who started with our legal literacy course and participated in our 6-month legal literacy course. She was kind of there in the back of the course, participating, and she told the story afterwards that she saw on a kind of every few weeks, one of our lawyers or paralegals would come to offer legal support to anyone who was interested. In the beginning, she just kind of looked at it and thought about it, but decided, no, I'm not really going to speak to the lawyer. And then over time, we started talking to them about violence against women, and our facilitators started talking about kind of women's rights, and not only that, but self-esteem and communication, and really building up some of these other skills that are so critical. And over time, our lawyer came back and she saw her again and thought, do I want to talk to her yet? I don't think I'm going to. And then it was the third time, and then the fourth, that she finally found the courage within herself to go and meet with our lawyer and ask for help. She was in an extremely abusive relationship, and really didn't have anyone to turn for help. Her family had basically told her that she needed to, this was kind of her life as a married woman, and that there's a term in Spanish that she needed to aguantar, like she needed to just live with this. And that's what it meant to be a good woman, a good wife. And that's something we hear a lot, is these kind of concepts of what it means to be a buena mujer, like a good woman. And it means to live with these things and not share them and be strong. And so she really had a lot to kind of work through, and our lawyer provided legal counseling to her. And I think one of the really critical components of the work that we do is we meet women where they are. So when you're working on violence against women, it can't be, this is what you need and should do. It needs to be to really meet women and hear where they are, what their needs are, and how we can support them in the process, because it is a process. It's a long process. And it often is not kind of what we view as, or what, our individual lawyers might view as success. It's not what success means for the individual woman. So we really try to meet women where they are. We provided her with psychological counseling. It was a years long process of working with this woman. She decided to finally file a complaint, because the abuse had gotten so extreme that, we were really concerned about her life. And she filed a complaint and received a restraining order and went through the criminal process. And, then when she had that restraining order, she was living in her home with her children, and her partner, her spouse, came back and was threatening her. And in that moment, she called WJI, and we immediately called the police. And it was like a very immediate reaction in terms of just him recognizing that she had somebody she could count on who was going to respond and be there in that moment. And he never came back after that. And in fact, after that, we worked with her not only to secure kind of child support for her children, but then also to title her land in her name. So it's this long legal process that ended up with her having the title to her home, the title to her land. And she told us by the end of the process that it was the first time that she felt safe in her own home, which, I think is just such a transformative thing to hear a woman say that for the first time in my life, I feel safe in my own home. So for us, that's just an example of one of the success stories. Obviously, it can be a long process. It can be years, and there are many, many pieces to it. But those successes make it worthwhile in the end for us. And she continues to be in that home with her children and has not had additional threats from her ex-partner. And we're really happy to be able to share those stories of success.
That's amazing. Thank you so much. I have one more question. This one's for Ruth, actually. How do you communicate about your...
I see it.
Oh, okay.
Sorry, I didn't mean to interrupt you. You can totally read it.
No, it's like, how do you communicate about your involvement with Home for a Home, and how do they respond, your clients?
Yeah, it's a good question, Nick. I could probably do a better job. I think there's two different camps of people who are donors, I guess, if you'll call them. There's some people who do it for like a marketing reason, like maybe that's the big reason. And then there's other people who do it just to do it. And then there's probably a big camp like right in the middle, like, it's a good marketing thing and it's a good thing. So I'm like really a really big believer, and especially as I've been fortunate to raise up in my career and, sell more and more houses, I feel like I have a duty to the community to give back to them as they've given to me. And I feel also like just within the industry, like those of us who are doing really well have a duty to show leadership around giving back to communities. So I don't communicate it. The short answer is I don't communicate it with client. I don't talk about it in listing agreements or anything like that. We do have it on our website along with a plethora of other organizations that we give to. And we do different things like we try to post a few things that come in. Like if there's a house that's sponsored, we'll post it. I think we could do better. I was losing some of them from Chris last year. Like I got halfway through the year and I was like, wait, haven't I built any houses yet? And apparently I had some sort of weird filter set up on my email. So we could do a better job with that, because I think in the vein of just being an example to our community, I think posting it that way is more important to me than trying to get business from it by like talking about it in a listing presentation. But I do think, especially millennials, and there's research around this, that they think it's important to work with somebody who is giving back. And there have been a few people who in listing presentations and stuff have mentioned to me, like, I know that you're really big into philanthropy and we think that's really cool. We want to work with you. It's not a ton of people, but it is some. And I think, you know, another thing that we do every year is like we send out like an email to like everyone who's on the newsletter list and just say there's 2,000, 2,500 people. Whoever responds to this message, like we will donate to your favorite charity. I will donate to your favorite charity as long as it aligns with my values. Just tell me what the charity is. And then, you know, I usually allocate $30,000 for that campaign. And just depending on how many things come in is depending on, is it $1,000? Is it $800? Is it $1,200? And so over the years, I've been doing that for a long time. Like I've become kind of known for that. And so people do like talk about it. So it's not like specific necessarily to Home for a Home, but I think in general, I think it is like, I feel like real estate agents have a pretty bad rep for just like making a lot of money and not working very hard, even though that's not necessarily the truth. But I think it's important that there is some sort of, you know, like public display of like, yes, I appreciate that we are in a fortunate place to make good money. And we're also like in a fortunate place to give back to the community.
Awesome. Well, as we wrap up here, I just have to say a huge, huge, huge thank you to Anne and Kate and Ruth for spending time with us tonight, and on the advocating side of things, which thank you, Ruth, for doing that. Yeah, I just would say as we were planning this and talking, and you know, as all of you, like if you're like, well, what can I do? How can I be more involved? And, you know, of course, there's always donating. None of us are ever going to cry about that. But I think it is just being a voice and letting, you know, letting people know what the issues are and what's happening. Yeah, if you guys have any other, you know, final words you want to say, thoughts, so we're running here at the end of time. But yeah, thank you guys so much.
Well, thank you for inviting me to join you all. It's really exciting to see all of you here. And, you know, just want to say, Chris, thanks for the work that you all are doing in Guatemala. It's so important. And it kind of intersects so closely, as I said, with the work that we're doing. And we just really appreciate it.
You bet.
Yes, definitely. Just thank you so much for your time tonight and for supporting Guatemalans. We couldn't do this work without you. So thank you, and your support, especially for, you know, supporting Home for Home and our organizations. It's really important, especially during difficult times like we've just had over the past year.
Absolutely. And if you guys, yeah, please just reach out to me. If you want to know more, I can put you in touch with any of these folks here. Yeah, we'd love to hear more. And again, thank you guys so much for being here and all the great questions.